I feel like a marvelous thing about our graduate programs here is that they are very focused on this idea that you can be trained to do stuff that's impactful.
I really love how faculty are very enthusiastic about getting trainees interested in research and involved in research projects in a meaningful way where you feel like you can present this information at conferences and that it'll have a big impact.
You know, when I started medical school in 1986 to now, the transformation induced by the growth of scientific knowledge is mind-blowing. And it's only getting faster.
Yeah. I find that really exciting that you actually see this translation happening. And now I feel with everything speeding up, with how important molecular diagnostics are in impacting patient care, you can really see how you can make an impact.
I'm very passionate about our trainees having opportunities and more of them being devoted in their PhD years to true translational research.
Yeah. I think that's what drew me not just to pathology but to the subspecialty of hematopathology, is that a lot of what you study clinically is going to have a huge impact on patient care. Even if it's not necessarily like a cure, we can give you quality of life for months, years. And that's amazing to somebody who, you know, has children that they want to see grow up.
Cancer and immune diseases in general is a natural phenomenon of being a multicellular organism.
Yeah.
This is not going away.
Yeah.
We're just waiting for the next round. We're solving the cancers of the 60s and 70-year-olds, and you're going to have to solve the cancers of the 90s and the 110-year-olds. Yeah, I find that when I'm working with graduate students from various labs who haven't had a contact with histology, but they're working on some sort of, finally they get to the tissue and they sit down with us and they look on the microscopes. Their eyes, they're so big.
Yeah.
They're so excited.
Yeah. Getting to that part, there's so many steps that you went through to get to that part, and then you actually see the fruition of it.
This hospital for an academic medical center is actually a real jewel in the following way. This hospital runs everything from that emergency room to being the primary general hospital for a 1 million+ person drainage area, to doing pancreas transplants, bone marrow transplants, cutting-edge clinical trials, all under one roof.
Yeah, there's a lot of collaboration here. Yeah, I think that's one of the main things when I was looking at residency programs that really sealed the deal here. Obviously, because I went to med school here, I knew many of the faculty, I knew of the program itself and how well structured it was, but being able to have that breadth and depth of caseload, I think that's really important as a pathology trainee, and that's something that you get here.
So over there where the university is, that building, which is the MAG, the Memorial Art Gallery, is part of the original university.
Oh,
That's the footprint. Okay. And so they have beautiful spaces in there, gathering spaces that are used in university functions. The intermittent exhibits, they do a remarkable job with that infrastructure. It's among the places that is just a great relaxation.
There's so much culture here. The theater, even movie theaters like the Little, a lot of small cinemas, drive-in movie theaters, which I just discovered this summer around Rochester, the festivals.
But the fact that we are on that Erie Canal thing that goes straight from one side of the state to the other, and it's a bike route.
The green space is amazing, because even within the city, you have really beautiful parks. You have Cobb's Hill, you have Highland Park, which is really close to campus. And the Erie Canal Trail, I was really excited when I first came here because I'd always,
But you sang the song.
I sang the song, the song from second grade.
Yes, exactly.
Yeah, so I was really excited about it. And then somebody said, like, oh, you can bike to Pittsford Dairy from U of R's campus. You just get on the Erie Canal Trail. You go for, I think it's like 9 or 10 miles, which on a bike in the summer, it's beautiful. It's great.
We have a remarkable lifestyle here, don't we? Our commutes are tiny.
Yeah.
I think everyone who works at the Med Center, and when you're in graduate school, you're working so hard, you're working so many hours. You deserve to be in a place where you can take care of yourself.
Yeah.